the state's approach has been from a policy perspective in the administration of the vaccines, which is directly tied to why we are still in 1A and other jurisdictions have already moved on to their next phase.
Sure. Thank you, Council Vice President Albornoz, for that question. To the best of my knowledge and in conversations with Dr. Gales, and he's been in more conversations with the other health officers across the local jurisdictions, my understanding is that some of the smaller counties who receive their doses and have the capacity to move to 1B were asked to hold. And I don't have the backdrop or the story around that. I know that they're trying to move in unison, but in some jurisdictions it may hinder on the progress in other jurisdictions. And so I do know that most of the guidance and policy is set by the Maryland Department of Health, as well as the allocation of vaccines. And that's as much as I'm able to share during this briefing to Council this morning.
So the bottom line, go ahead, Dr. Stoddard.
I was going to say, I think that Dr. Bridgers has it correct. I think in my view, the state may have misestimated where the priority group populations were. And so you had jurisdictions that received more doses than they had people in category 1A and were able to complete those over the first week of vaccinations and have extra doses that they wanted to move into category 1B with. I think if those distributions had been more accurate in their distribution across the state, we would be further into our 1A and they'd be finishing up their 1A and we would be all in sync. And now we've got this discongruency that is emerging over the state where the larger jurisdictions with more primary care providers or more healthcare workers are lagging in terms of percentage relative to the smaller jurisdictions who are fully through 1A. And so I think if those estimates had been better earlier on, you would have a more even distribution of jurisdictions ready to move into phase 1B. I don't think it's going to be a vastly different amount of time. It's going to be a matter of weeks, but I think when we talk about weeks right now, that's too long. And I think we all agree with that. I think we would absolutely like to be have had more vaccine and we would be through 1A at this point if the distributions had been more accurate.
Yeah. I can't speak to just one other thing. I can't speak to Northern Virginia's or Virginia in their process around how they do the allocation. And talking with my counterparts in human services around health and human services around the state, they are as equally in the dark about sort of the process and the flow and the state's decisions about distribution of vaccines as we are. DC, of course, being both state and local, manages that process, and with a much smaller number of healthcare, much smaller population, both in terms of 1A and others, their ability to move into 1B is not surprising given the size of their population and the number of people they have to vaccinate. We are moving pretty fast with getting through our 1A, and I think we will continue to do that and get there and get ourselves into 1B over the next several weeks. I'm certain. But it just takes us longer. We've got a large number of healthcare providers.
And I would also note one big thing too is we don't know what the uptake rate is in any of these jurisdictions, meaning that we may be in 1B in a week from now because we don't get as many people coming in through this, tier 3 category of 1A as we thought. That's not particularly good news. I mean, it would be good news that we got into the 75 and older population, but it would also mean that there would be a substantial number of our primary care providers who are refusing to take the vaccine, which has other implications because they would then potentially not be advocating that their patients get it at a later point if they're unwilling to get it themselves. And so obviously we're kind of hoping our number of our primary care providers come in and get vaccinated. Maybe that takes a little bit of time because so many of them are interested, but I think we don't know that until we start taking those folks in and having them come in and get vaccines and taking those reservation slots.
So needless to say, it's frustrating is not the right word. And there needs to be accountability at the state. And so I think we are going to have to work with our delegation in ensuring moving forward that there is accountability for what has transpired. To Dr. Bridger's point, we have the capacity in Montgomery County to provide between 2,500 and 35 vaccines per day. That's 17,000 to 24,000 per week. And last week we received 6,700 vaccines. And we are hoping to receive 12,000 in the upcoming week. So it's clearly a supply and demand issue, and the state needs to reallocate and pivot its policies immediately in order for us to be able to vaccinate the regions in which there has been the highest concentration of spread, the greatest amount of deaths, and it is absurd that we have not been able to achieve that. And so my frustration is not to our public health team, but to our state officials who have not been transparent, who have not provided clear communication, and who have not been doing their job. And so that needs to be addressed, and it needs to be addressed right now.